What can be done to make my face a bit more symmetrical? I wore braces as an adult for 3+ years, and I still look crooked and bite my right cheek when eating. A dentist said I still have a bad malocclusion, and my ortho said that was the best he could do given my particular mouth, and that the asymmetrical appearance is because of my facial muscles. My lower right jaw is obviously larger than the left side on an X-ray. A PS said he could put Juvederm into the deep, harsh line between my nose and mouth on the right side when I smile to see if that helps. Any opinions?
Thank you for your question. You submitted a photo with your face relaxed and smiling, and you described that you've worn braces as an adult for several years, and that you have a challenge because of an issue with the difference on one side or the other in terms of your jawbone anatomy. And you've seen a plastic surgeon regarding the desire to improve symmetry, and the doctor suggested to address the line you describe from your nose to the outer part of your mouth, that he could put some Juvederm, and that certainly it seems to encapsulate the question. But you were asking, how do you make your face more symmetric? Well, I can certainly give you a perspective on this. I'm a board-certified cosmetic surgeon, and facial rejuvenation is a big part of my practice. I've been practicing in Manhattan and Long Island for over 20 years, and certainly this type of challenge is something that we deal with a lot in our practice. And with the understanding that the human face is naturally asymmetric. I will say that we're beautifully imperfect. And many people try to address asymmetries. So with that being said, understanding that Juvederm at this point, with the way your doctor is suggesting, is being used as a dermal filler. A dermal filler means that it's being placed in the level of the skin called the dermis. Now the dermis has only a certain amount of thickness, and it can be placed in that area and soften that line. Now, it is something that is very common that doctors consider looking at the face based on patients' concerns. Patients typically, or people in general, focus on lines. Well, there's another way to also look at your face, and that is to look at the volume. So you said that one side of your face has a larger bone structure compared to the other. Well, we have an approach in our practice which we refer to as structural volumizing, and this is derived from a method called the Y-lift. Now, the Y-lift is a way to help rejuvenate the face using a filler, a hyaluronic acid filler, such as Juvederm and Voluma. But as opposed to only focusing on the lines, I will say the lines are only part of the picture. They're part of the reality that there is a difference in volume. So there have been many patients who have come to us who are focused on those same lines, and they're referred to frequently as nasolabial fold lines or parentheses lines. People will often come with that concern. But I can tell you, doing this type of work for over 20 years, that you can make an improvement and you can make someone happy, and they will be satisfied. But when we do structural volumizing, such as restoration of volume or balancing volume in the cheek, the jawline, the chin, the angle of the jaw or the angle of the mandible, then consistently people look in the mirror and they are very impressed. And what's particularly worth noting is that they will not think of the line as being as significant as they did before. And the reason is that in the context of the restoration of proportion, and that's probably what's really bothering you, is that there is something called the golden ratio. The golden ratio is derived from the Greek culture about balance in nature and balance in aesthetics, and it's a ratio of 1.6 to 1. And a lot of times people walk around this city, in New York City and Long Island, and their faces are all bloated because they have so much filler and there's no angularity or balance. Or they have very large facial implants or too much filler in their cheeks and their balance is off. But when you see natural balance, it looks really nice. And so something to think about is, in addition to the strategy of filling the lines, is look at your face and think of structural volumizing as I described. With the Y-lift, what we're doing is we're putting Juvederm at a deeper level on the bone structure below the muscles and having this structure expand and balance out the face. You can actually put many syringes of Juvederm, and paradoxically, you won't look swollen, you'll actually look thinner. You'll look like you have more structure. So I think that in addition to the nasolabial fold suggestion, and it's not like we don't do that, we do that as well, but it is certainly a perspective that you may want to think about when you understand that it's not the fold so much as it may be the rest of the face and how to balance it out so it looks more like in proportion. Again, thinking of the golden ratio. Of course, injection in the nasolabial fold will soften that line, but I'm not sure it'll be as good as you hope. But that's more about the communication between you and your doctor. It's very important to understand what your expectations are and whether the doctor can fulfill those expectations. With that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.